Welcome to Women Leading in Health. I'm Dr. Linda Edwards, and this is the podcast series that explores the skills and mindset required to lead in the world of health and medicine. Whether it will be an emphasis on teamwork, communication, or adaptability, I'll be finding out what makes these female leaders tick and how others can model their success. Today, I'm joined by Dr. Cathy Winfield.
Hello, Linda.
It'd be wonderful if you could tell us about your career pathways. I think it would be really interesting to hear about those different roles in the NHS and your pathway.
Yes, I started off in clinical practice as a nurse and always enjoyed looking after people in their own homes in the community. So as soon as I could, I legged it out of hospital nursing and into a community role, and then became really interested in why I and some of my colleagues differed in things like how many visits we did for patients and when we put patients on for a visit. So we became very interested in what would now be called resource utilisation, but I didn't know it was called that. I was just plodding around as a district nurse, wondering about this variation. And then eventually I was asked by the Director of Nursing to do a project, which was very interesting. It was about workforce and beginning really of workforce planning, I would say. So this is now, we're kind of in the sort of early 90s now. And I sort of said, well, you can't really answer the question about workforce unless you know what outcomes and what quality you're expecting from a service, because they sort of triangulate. And so then I became very interested in quality and quality assurance. But through all of those sort of bits of work, I suppose started really thinking about services and being more analytical about services, and eventually, got various management jobs, was a neighbourhood nurse manager in the days of Cumberledge. Feels like that's coming back round again. Became a director of nursing. And then eventually, when sort of commissioning and planning became a function that the NHS was doing, I was very, very interested in looking at the array of services to meet the needs of a population. So I became a director of commissioning. I think we had PCTs first, didn't we? So I became a director of commissioning in a PCT and did that for quite a while. PCTs kept changing shape, big, little, reconfiguring, and I just kind of kept moving around the system, broadly doing commissioning and also working on partnerships. So working closely with local authorities and with other stakeholders in the system, our provider colleagues. And then eventually, when clinical commissioning groups were established, I became the accountable officer for clinical commissioning groups, saw them through mergers to become larger. And then through the work that we were doing, we were identified as a Wave 1 integrated care system by NHS England. That was based on some of the things we were doing to operate differently in my geography and some of our outcomes. And that was a really exciting opportunity to work directly with the national team and indeed with some of the politicians to redesign the architecture for the NHS and to develop integrated care systems. So that was kind of my journey from being a frontline clinician through to being an accountable officer and leading in ICS.
I just wondered whether you had a career plan, and if you did, whether it worked out the way you thought it might.
No, I didn't have one at all. And I can remember when I was interviewed, I think for my district nursing post, so I would have been about, mid-20s, and the director of nursing said to me, where do you see yourself in 5 years' time? An absolutely standard interview question. And I can remember going, 5 years? I've got no idea. And I was really shocked to be asked the question, really. That's how naive I was. So I don't think I did have a career plan in the beginning. Once I became a director, naturally I had an aspiration at some point to lead an organisation. And then having led my CCG, I could see that we needed to work differently in the system and started doing a lot of work around the integrated care system. And at that point, when we became a Wave 1 ICS, we literally got this message that we were in the tent of this cohort of Wave 1 leaders, but we needed to identify a name lead by lunchtime. And I happened to be with my other chief exec colleagues and their chairs. The chairs all said, we don't mind whichever one of you three wants to do it. One of the chief execs said, well, I've only been here 6 weeks and my taxi's outside. I don't care which one of you two does it. And my provider colleague chief exec said, well, I'd be interested in doing it. And I said, well, so would I. And he said to me, make your case. So I said, well, as a accountable officer in a clinical commissioning group, I've got an overview of the whole organisation. I work with local authority, all the providers. I work with primary care. I've got the full picture. I've got the budget. We do the work on health needs assessment. And he went, stop there. You better do it. You've won, kind of thing. So he was convinced by my argument. And actually, I think, to be fair, those chief execs were very busy running large organisations, and we often rotated things like the chairing of meetings, or rotated some of the roles between us. But quite often they would ring me and go, actually, I can't do it because. So even when we tried to distribute the leadership, that just proved challenging because they had massive day jobs, and running an ICS was much more akin to what I was already doing. So no, I didn't really have a career plan initially, but I gradually developed my interest and then developed my aspiration to lead a system.
So we've talked about leading systems and things. How would you describe your leadership style?
I think I've always got quite a clear vision of what we're trying to achieve. And I think quite often I've played the role of interpreting national policy, being able to knit that together and describe how that might be in our system. And I've done a year in NHS England. So what I observe is that quite often you have teams working in a fairly siloed way, to be honest. So you'll have an urgent and emergency care team, an elective team, a team focused on primary care policy. And these policies sort of drop down like custard pies into the system. And quite often they're not that coherent. So if I take, for example, the policy that walk-in centres should become urgent treatment centres and should have a GP in them, fine. Then we have a policy, we need a GP at the front door of ED. Then we have a policy that we need a GP sitting in a clinical assessment service in 111. And then everybody goes, goodness me, primary care, we need more GPs in primary care. People can't get appointments. Well, we've just spread the GP jam really thin. And we haven't said, let's take a patient and see what would their journey be through the system, and then where is it best to put our resource. We've had different policies coming up with this sort of scattergun approach. So quite often our job was to say, well, that's what National say they want, but what's the problem they're trying to solve, and is there a better way to solve it? So we put our GP in ED. It was not effective as a use of a GP, and we just took them out again, and we could say why. So it was much more about creating the vision, creating the leadership, understanding the national direction of travel, but then making it relevant locally, bringing along partners as well. So I did a lot of getting alongside local authority colleagues and elected members. I think one of my learning points was when to play myself in and when to play other people in. So we had a peer review, and I'd worked really, really hard to sort of win the confidence of local councillors. And the person that was doing the peer review said to me, really, you should play in your GPs much more, because there's a much more of a parallel. GPs tend to work in their practices, be there for a long time, really know their communities. That's the same for local councillors. And they will naturally probably have a degree of respect for GPs, that managers come and go. And so really exploit that relationship more, and you step back. So that was a learning point, really. You need to develop those relationships, but it doesn't have to be you. And it's how do you deploy the skills of the organisation in those relationships. So I'd say my leadership style was about creating the vision, developing the relationships, and sort of creating the permissions for people to do something different, and really pushing at the boundaries and going for the flexibilities where they exist. Judging risks, but taking a risk-based approach to things to get to the right answer. So I'm not saying, behaving recklessly, but I'm saying if there are opportunities to do the right thing, find the route to get there safely, rather than go, we can't do that because of XYZ process. And that was really helpful, I think, and giving people confidence to do that.
It sounds to me like you developed a tactic of getting yourself out of the way and allowing other people to grow and develop. How did you arrive at that?
It's a really interesting question. Well, I mean, you realise that you can't cover everything, and that you've got a team. And I was lucky that usually I was in the position of being able to recruit quite a lot of my team. Not everybody, but I was often in a position of recruiting, setting up a new organisation, whether it was a CCG or an ICS, and therefore being able to recruit people. And select the people that were going to bring the right skill set, develop those people, and then, as you rightly say, set the frame say for diabetes, we want to be in a different quadrant. Off you all go, guys, and redesign it and come back with the answer. And sort of allowing people to do that really, and sort of nudging and tweaking as they go. So more the role of critical friend, and then coming to an endpoint and being able to go, yes, let's do that thing. So yeah, I think that was sort of my approach really.
I'm sure there've been many outstanding moments, but are there any that really stand out for you as defining moments in your career?
I suppose, being able to be a Wave 1 integrated care system was a great opportunity, because at that time, NHS England and the politicians were thinking about, we need to do something different. We need to bring things together differently. Probably the provider commissioner split hasn't always been as successful. It's put too much competition into the system, and that's had disbenefits. And so we were beavering away doing our thing in my patch, and we got this call, you've got to have this interview with Simon Stevens, deputy, and, blah, blah, blah. And then we passed the test, if there was a test, and we were all met together for the first time. And Simon Stevens came into the room and he said, right, now you guys, you 10 are in this room because you know how to break the rules and bend the rules. And we want to rewrite the rules. So we need to learn from you. And I immediately felt I found my tribe, because I'd spent my career sort of going, it's ridiculous, and finding ways round things in exactly the way that he described, and sometimes being criticised for that. And so I suddenly thought, this is really liberating. And so having the opportunity to kind of work with a team and actually, draft some sections of the long-term plan with some colleagues was just fabulous. And also to learn from the other integrated care systems, and some of whom I'm still in contact with, people that were in that cohort. It was a sort of bonding thing, really. And people just did great and fantastic things. And it really accelerated our learning between us. So I think that was probably the part of my career I enjoyed the most, because I felt I was at the beginning of a sort of social movement, if you like, and which then crystallised and became a real thing.
So, I mean, obviously Simon Stevens, the former chief executive of the NHS, was quite influential at that point in time in your career. Who else has inspired or enabled you to grow and develop, and what did they bring to you?
A couple of other chief execs that I've worked for. I mean, in my early days of my career, in a community trust with the chief exec, Carol Pearson, who then created a merger, one of the early mergers between community and mental health organisations. So the experience of going through that under her leadership style, her values, her obvious prioritising of patients, and her respect and way of working with staff were really good values to learn. What I found early on in my career with leaders is, there'd be a problem and they would sort of go, well, obviously we need to do this. And I'd be thinking, well, how is that obvious? How do they know to do that? And so I suppose in my own part of my career, I sometimes struggled to work out how they went from A to B so quickly, because they'd obviously developed that expertise. They had that experience over years. So, but she was definitely somebody that I felt I learned a lot from. And she gave me some of my early opportunities to do stuff that I wouldn't otherwise have done. I mean, one of those included project managing the new build at a community hospital and bringing in a health centre and creating a primary care centre. And I said to her, but I don't really know how to do this. I've never project managed a capital programme and I don't know how to write a business case. And she went, well, here's another business case. Just do what's in that. Off you go. You'll learn. So in a way, huge respect to her for giving me a go and having the confidence that I could do it. Slightly stressful because I did have to sort of learn, but she must have known that I would. So yeah, I think being stretched, being given different opportunities, and modelling some of those behaviours, I think was really sort of quite important. And then other sort of leaders, I always quote Mark Britnell really as another leader that I was impressed and inspired by, largely for, I think, his sort of, well, his intellect and his sort of analytical capability and his ability to think more broadly about the problems and solutions that we face in the NHS. So, and again, his style. And he would tend to sort of say things, I think deliberately, provocatively, and just see how many people would push back. And what he didn't want was to people just sort of agree with him, really. He wanted someone to stand up in their corner and go, hang on a minute. So that I quite enjoyed that. And our paths still cross occasionally, which is good fun. So
do you think that women lead differently from men, or do you think it's just a smokescreen?
I think they do. I think they do. I think they're naturally blessed with greater emotional intelligence, actually. Maybe that's a hugely inappropriate thing to say, but it is just my lived experience. And they probably have more concern about that sort of thing than maybe men do. And I think that's really quite important in leadership, to really understand the vibe in the organisation, understand the feelings and reactions of your stakeholders. I mean, I do remember in my very early days as an accountable officer for a CCG, I sort of knew my job was to have a relationship with the local authorities. I thought, I'll get all the chief execs together, all three of them, my three local authorities, and have a bit of a chat. And I'm new, and I'm going to introduce myself and talk about my ambitions for the system. And they were all men. There was me and these three chaps. And my secretary at the time is absolutely delightful, but she was a vicar's daughter. So I invited these chaps in for lunch. And before I knew it, we'd got doilies, pink serviettes, little cakes, bits of quiche, definitely on the feminine end of the spectrum for a lunch. And these chaps arrived, I think they wondered what they'd walked into. And I did my little spiel about, it worked out, and they just looked at me and didn't really say anything. I could literally feel my heart pounding, thinking, this is really going badly. I don't know why, but, I'm not getting much back here. They're not speaking. They're barely eating the quiche. What's wrong here? And eventually I understood that they were highly fed up with the NHS and the previous organisation, and there were lots of points of dispute. So once I understood that, I had to kind of reverse, get alongside the issues that were bothering them, work those through, take myself off to various scrutiny committees and explain things and get things on an even keel, and then go back to where I'd been 6 months previously to move forward. So having that emotional intelligence to know this is not going well and find out why, and then get alongside people was really important at that point in time. And interestingly, I'm not going to sort of name names, but I'm watching a similar situation unfold where the male chief exec is just going, well, they're all annoyed with me and I don't know what's wrong with them. I know what's wrong with them. But, you've got to find out then if you don't know, and you've got to do something about it. That's not needing kowtow and appease people, but it's, get out there, be open, acknowledge the issues and find a way to work through them.
And I guess having that awareness is something that most people could learn from, really, because I think a lot of people think, as a chief exec or a leader, you've got the solution. And I think it's really helpful to understand that actually a lot of the time you don't, but you know how to find the solution.
Yeah, exactly that. And it is that, what's the phrase of it really, where you're sort of handing back the power around the solutions to other people. You're still holding the ring, and ultimately somebody's got to make the decision, we're going with it or we're not going with it. But absolutely, you don't own the solutions.
How do you maintain some balance in your life?
I mean, I'd say there were times when I failed quite badly at that. I remember the year I mentioned the capital project that I ran. That year, I had my second baby. I was doing that capital project and bringing that to fruition. And I was also submitting my PhD thesis. I think that goes down as my worst year in my life ever for appalling work-life balance. I managed on very small hours of sleep. And my chairman at the time said he was also, funnily enough, part of the university academic body, so also was there when I was awarded my PhD, that he said it's been a miracle and a mystery as to how all this has been achieved. And I think he's absolutely right, it was a miracle and a mystery. So probably wasn't very good at that early on in my career. And also the impact of you not being good at that is felt by others. So I'd be the one that was sort of like, come home, because I had to be home for my children when the nanny was going, sort all the domestics out, and then start again about 9 o'clock and find myself on email at sort of 5 past midnight. And people come in the next day to sort of a list of emails from me throughout the night. And eventually somebody plucked up the courage to say to me how stressful that was for everybody and how it made them feel pressured. And I'd never thought of it like that. And I stopped doing it, which is probably good for me as well. So, yeah, you kind of needed that feedback. It really brought, it was obviously something that was junior to me, but I think knew I would take it. And I did take it, and it really was a wake-up call. So there have been times when I haven't done that well. More latterly, I think you get more confident in your role and in yourself, and that the world's not going to stop spinning if you don't do whatever. And you do kind of build in the time to sort of socialise, go in the garden, be with friends, and all those things that keep you going, really, and take holidays. I always take all my leave, and I'm always scrabbling for extra leave. I know people say they can never take all their leave. I don't understand that. I have my holidays booked, several ahead. So to me, that's vital.
We've heard quite a bit about the career pathway that you've taken. What key piece of advice would you give to somebody who's starting out in the NHS?
I would say to them, get a broad range of experience, really. Try to work in different sectors. It depends what they're doing, obviously, but try to work in different sectors. Try to get broad understanding of what's going on. Try to get some early exposure to some of the more strategic stuff. Try and get on a working group within your organisation. Try and get on a regional board or something. And that happened to me very early on in my career. I got asked to work with a regional team on palliative care, and you sort of start to learn the machinations of how committees work, how you produce a report, and you get the list of authors at the end and how that's done. So the mechanics of some of that is quite important. Understanding the operating context down from DH, and understanding that when we're asked to do stuff that seems bizarre at short notice, that will be a political requirement. And the person asking you is probably as fed up as you are. And there's no point railing against it. You sometimes just have to do what you have to do. So I think that's what I would say. Get a broad exposure, try and get exposure across the sector, try and get exposure upwards so that you're looking upwards as well and learning. And start to think about what interests you, what are the bits of the job that you like, and where do you then see yourself going. And probably not initially like me, but later on in your career, you'll start to find what floats your boat, and that's the direction that you then want to develop and go in. And I would say take all the opportunities for personal development, whether that's, specific programs, whether it's coaching, take all of those opportunities as you go.
That's brilliant. Thank you very much, Cathy.
Thank you, Linda.
If you enjoyed this episode, then I'd really appreciate it if you could rate, review and subscribe. If you're keen to carry on this conversation, then you can find us at Ed for Health over on Twitter. We'd love to hear from you.